Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, everyone, and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager. I'm your host. This is a really exciting week for us at the Institute for Functional Nursing. We launched our first cohort of the Functional Nursing program this week, and we had a really unexpected turnout for students signing up for our first cohort ever. It has been really great over the last few months to see everybody joining and starting to connect in our membership and the bigger community that we have for everybody to be connected. And so now that the program has officially launched, it has just been really exciting. This episode is really an update about the several conferences that I attended recently, including with some of our faculty and students. And so I wanted to share a little bit about what that experience was like. If you have been paying attention to the weather, you may know that some of the areas I was in were a little bit challenging weather-wise. So first thing just being that's so exciting that the program launched, that we have all of our amazing faculty. I was watching our video in Module 0, each faculty member introducing themselves. And it was just a really wonderful thing to see and see everything coming together that we've been working on for so long. I feel like this program is such a long time coming. Thank you for everybody that has helped to make this happen. I think it's a really special thing. Attending these conferences and talking about what we're doing at IFN, it got a lot of really great feedback. I'll share more in this episode about that too. Funny thing to start is, so I went to the American Association of Nurse Practitioners Health Policy Conference in Washington, D.C. So that was the first part of the trip. I was joking with my sons that I was going to be flying there on a Friday, and it was a direct flight into Reagan because I knew it was cold. I didn't want to commute from the other airports. I was joking that you may know that airport, I believe, was essentially created so that it was easy for politicians to fly in and out of the airport and back to their homes regularly and not have to commute out of the city for the airport. I was joking with my sons that going back to that area where I'm from, that I might end up sitting next to a politician on the flight. And what would I say if it was something? Anyway, we were kind of being silly about that. I never think about who I'm going to sit next to on a plane. I ended up sitting next to somebody that's a nurse practitioner that I worked with in cardiology a long time ago. And he is now faculty at a university in Alaska, was headed to the exact same conference as me. We know a ton of the same people and hadn't seen each other in I think it was probably 10 years at least, maybe 15. So we spent the whole flight catching up and talking about health policy and health education, nursing education. And so that was really fun and a great surprise. I got to make some new friends in DC that he had brought along with him. Some of his past students came as attendees for the conference. And luckily, if you listen to the episode I did last year on this conference, I ended up being the only person there from Washington State. And so my first time ever going to advocate for health change and to lobby with politicians. I was the only person attending those meetings from my state. And they had told me that was very unusual, that normally Washington had more people there. And that was certainly true this year. We had more people from our state. And so I didn't have to go by myself. But what was interesting about that is that some of them ended up being the friends that I made and that he was friends with. And I ended up being the experienced one at that point. It was kind of funny. I remember worrying last year about just how the conference would unfold, what it would be like to go to Capitol Hill, try to even just get in the buildings, the logistics of getting there, and then actually advocating for change, talking to politicians. I was, inexperienced and kind of nervous about that. And last year went really well, other than being alone. So I was see one, do one, teach one, like the nursing thing. So I was able to share that with them and hopefully ease some of their worries. And I think that it went really well. The conference itself, I'll tell you a little bit more about. And, I love going back to Washington, D.C. It was freezing cold. I think it was single digits, maybe 12 degrees the first few days I was there when I had time to explore. So the whole trip that I was on for these conferences was quite cold. So I wanted to tell you a little bit about that actual conference and just touch on how that experience went. We spent a few days listening to speakers and learning a bit about the policies we're going to advocate for and just our role as nursing professionals, as lobbyists. And I talked about that quite a bit in the episode from last year. So if you want to hear more about that theme, you could go back and look at the AANP conference recording from last year. Same, it was February last year also. I found out, I was like, why are we in DC in February? DC is really great many times of the year weather-wise, but not February. So I found out that it is actually the best time to get policy change initiated for us. And so that was the logic behind that. But they had several speakers, and then on the third day, we met up for a little bit with our individual states and kind of walked through who was going to take the lead and how we were going to divide up the discussion with the folks on Capitol Hill. And then we all took the metro, which is fun. It was, I think for some people, it was maybe their first time. I love the metro. I love cities that have great metro systems. We took the metro to the Hill and we got to go in the different buildings and talk to our politicians. And it was much easier this year since I knew our way around and could get us to the rooms on time. Last year, it was fun to walk around and explore, but it definitely took me a while to get comfortable with where to go. But actually being able to go in and have those conversations is so important. That's a lot of what I talked about last year. And so the one speaker from this year that I wanted to just touch on for a minute, her talk is Gail Adcock, and she's a nurse practitioner who is a senator from North Carolina. And she was talking about her journey to becoming a politician from a nursing professional, which is really interesting, and just the role of nurses and nurse practitioners that are in politics and what that looks like, how it can influence the types of things that you end up advocating for or being maybe an expert on in the political arena, like the dynamics there, what it's like to be a new politician. And so she had a lot of really great insights there. I made a couple notes that I thought were really meaningful as take-home messages from her. I talked last year about why we need to advocate for health policy change and why nurses need to spend more time doing that. The message that she had, I felt like, was really concise and really great points. She said, when you are reaching out to politicians, be it you're writing them a letter, you're calling them, you're going to meet them in person, she said her three tips were to show up, to just please participate, because more of us need to do that. And that may be in various forms. It doesn't have to be flying to Washington, D.C., for example. Increase their understanding. And that, I think, is the most important part, is that we, like I mentioned last year, that we have lobbyists through AANP that are paid to live in Washington, D.C. and know the politicians and that game that is played there very well. But it's not the same as us showing up, because we can speak from lived experience. We can connect for these politicians what it means to make change in our communities and for the people that they serve. Like I mentioned last year, our local congresswoman lives in the town one over from me, and her grandparents worked in the same hospital that I used to work in, and she has had health struggles for some of her family members. And so a lot of the conversation we were able to have was really individual and unique to our community. And it wasn't just something that a lobbyist might say in DC. It was more meaningful, I think, for her. And I was able to make some connections about what it's like to be a healthcare practitioner in our community. So increasing their understanding is really about us being the lobbyists, right? Showing up and being the expert in the room to have them able to understand more about a bill. Politicians are not experts at everything. And so whoever's in their ear is who is informing the decisions they're going to make. And I think that more nurses need to show up. We are the ones that I think advocate the most for patients versus the American Hospital Association or the American Medical Association. They may have different agendas when they're lobbying, but I feel like when nurses are lobbying for change, it tends to be in the best interest of the patient at all times. It's not about revenue or anything like that. I hope that some of you are inspired, if not already, from me talking about this a lot in the last few years, to please take some sort of action in your community or nationally, whatever is meaningful for you. But be that expert that can offer to answer questions or be a resource that your politicians can reach out to when they do need some expert guidance on something they're going to make an important decision about. The third thing that she said is to speak their language. And so that being really important for us when we we do show up, to explain things in a way that are meaningful for them and to find how it's going to apply to their constituents, the community they serve. But also, I think nurses are pretty good at this, but we all know the experience of like a physician being in the room, talking to the family, using a lot of medical jargon. They leave and the patients are just confused. The family members have tons of questions, and the nurse comes in and kind of explains it in a way that's more clear for them. And so, really using those same skills, even though we want to come across as absolute professionals, to actually explain things to the politicians in a way that they understand. And so I think in that way it's what does this mean for their constituents? What does this mean for their community? How is it going to improve outcomes in a way that they would be motivated to for? And a great example is we had a lot of big discussions around the legislature around nurses not being considered a profession and increasing barriers to nurses being able to get federal loans to fund graduate school. So that's going to decrease our nurses becoming nurse practitioners, worsen our primary care provider shortage. It is going to decrease our ability to have nursing faculty to train the next generation of nurses. And so that's a really great example of her saying speak their language. We were able to go and meet on the Hill in all these meetings. We could really explain, like, obviously it's offensive to imply that nurses aren't professionals, but we could go in and say that. And that isn't as meaningful as saying, if nurses can't get these loans, we're going to have a worsening primary care provider shortage. We're going to have a worsening nursing shortage. We're going to have less nursing faculty trained. And so that in itself was explaining to them the importance of this bill getting addressed differently, reworded to include nursing professionals. So I felt like that was the biggest talk I wanted to mention from that particular conference. If you are a nurse practitioner, I encourage you to attend. If you haven't yet, on AANP's website, whether you're a nurse or a nurse practitioner, there are a few days left where you can sign the letter that is being sent. AANP is actually one of the biggest advocates for this policy getting addressed and reworded. And I even saw something recently, I think it was an email where the physician's assistants are getting people to fill out the nurse practitioner one because we've done such a good job of lobbying and building an infrastructure for the messaging to come across to the decision makers. So I thought that was really cool. Other than that, I told you I made some new friends. The one of the leadership from AANP for our region got us all a night tour around DC that was in a warm bus, thank goodness. But we went to places that I've been going to my whole life, but I've never gone at night in the snow for sure. And so that was really fun to like get to hang out with everybody and then to get to go see all of these really beautiful areas of Washington DC at night. So that was really incredible. I have a feeling we'll make that an annual activity because it was really fun. So after that conference, I got to hang out with my sister and my nephew. I had a great time visiting some folks. I got to see my godfather, but took the train to New York, which I've never done before. And somehow I've never been in New York City, which is crazy. And so the Integrative Healthcare Symposium was there. And it was our first time for the Institute for Functional Nursing to have a booth at a conference. I put a lot of effort into creating what our booth was going to look like and getting our faculty. There was like just a lovely bonus that some of them were able to come help support me and answer people's questions about what we're doing at IFN. And our goal in going to that conference really wasn't like to get more nurses to sign up for the program right now, because I had a couple people ask, like, what are you guys doing here? What's your goal? Because we know there's not a ton of nurses here. And I was told that some years there have been much more nurses. So I thought that was interesting. But the reason that I chose it as our first conference, other than the fact that timing is earlier than like IFM, is that really think that the conversation needs to be had more, that nurses are a big solution to the challenges that integrative healthcare faces. And if you've been listening to this podcast at all, you already know that nurses can really fill a big gap in like onboarding patients, doing visits with patients, coaching patients, running groups. There are so many opportunities to use nurses to make integrative and functional healthcare more accessible, to address all these super long wait lists that practitioners have, but also to have the care more accessible and reduce the cost for the patient, because that is one of our biggest issues. It takes a lot of time for providers and it's really expensive. And so I feel like the more we use nurses in the integrative space, the more we're going to help address both of those. So our goal in having the booth there, really, because we knew that it was going to not be a huge nursing show up, was to really have those discussions. And we did. We were able to talk to a lot of people about what nurses can do in this space that isn't necessarily being fully utilized or even remotely so. There were several nurse practitioners giving talks at the conference. And so that was really wonderful to see. We did talk to several nurses that were interested in the program, nurse practitioners, but obviously new to us, so maybe not ready to sign up for starting a few days later. But it was really nice to connect with people and talk about what we're doing. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short on-demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the functional nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. So I got there a little bit early. I got to meet one of our faculty that wasn't going to be there for the conference. Caroline Ortiz is one of our faculty for our program. And I had several meetings with her at this point, but never got to meet her in person. So that was really wonderful. And then Chip Nguyen and Megan Crooker are both our faculty also. And they were able to come and help support us at the booth. And then Everest Goldstein is our faculty, and she was there as well. And her talk was really wonderful. So I wanted to tell you a little bit about some of the talks, just kind of high level things that I took away from the conference. If you look at the website for their conference, it's an incredible amount of speakers. And it was really hard to choose what talks to go to each time because there were so many to pick from. Several that I went to, I thought, and some of the faculty and students commented too, that it was really reassuring, actually, that they were really talking about things that we are doing in functional nursing already. And so it was reinforcing our practice is on the right track. There were a lot of talks on the themes of like using GLP-1s and even microdosing those, things that we have definitely been talking about at IFN, and like realizing people are on these medications, that there are many benefits and we don't know all the long-term risks, but how we can work with patients to optimize their health holistically and really optimize their nutrition when they're on these medications, or use it as a stepping stone for them to improve their health overall and wean off. And so there are a lot of themes around that. One talk that I thought was really interesting was Eric Dorninger is a naturopathic doctor and an acupuncturist from Boulder, Colorado. And he is associated with Blue Sky Ventures. It's cannabis products. And one of our students that was there for the conference is an expert in cannabis and has her master's in that. I've done quite a bit of training in it. And so I always think of it as like we were talking a lot, actually, all of us, about like things that are adjacent to functional medicine that we can use sometimes when, like, my example with cannabis is like always, if somebody's in a car accident and they have a musculoskeletal injury that is not ever going to be fully corrected, they may have chronic pain. And we can do a lot to improve pain with functional approaches, but sometimes we can't do everything. And so then we can use these adjacent therapies for patients. And so that was a great example. But he talked about some really interesting themes around using like the non-intoxicating forms of cannabis products to address health concerns and balance the endocannabinoid system. He talked about like addressing perimenopause concerns with it, mental health and sleep as an antipsychotic, for tremors, and even for healthcare workers and building their resilience. And so it sparked a lot of great conversations. He came by the booth several times and we were able to talk about all that. And one thing that I thought was really funny, this kind of a side note, is he had talked quite a bit about sleep and improving sleep and restoration. And he gave us samples of those. They were all non-intoxicating, but they're good for sleep. And it was funny because the faculty all came back and were like, oh, I had a great night's sleep. So it was nice to be able to try that out. Yusuf Ilyamin is a really popular functional medicine speaker, and I think all of us agreed, like, "Oh, we have to go to this one because he, is so fun to listen to when he's talking." And the take home for me, because he shared a ton of pearls, I made a lot of notes, but one of the take home messages that I thought was interesting to think about is how we need nitric oxide to pump our glymphatic system and remove toxins and other waste. And these can contribute to brain health concerns. And so the idea of like connecting nitric oxide to like dementia or like brain health concerns in a way that I hadn't really thought about it that much before. And there were a lot of in the areas of the conference where it was the exhibit areas, there were a couple of those. There were a lot of people selling like those pads that you can stand on and they'll like shake. We were joking about making a video, but we didn't end up with time. So I thought that was a really interesting topic and just, all the different ways that we can get our glymphatic system pumping more and, sedentary lifestyle contributes to that. So just getting up and moving even is meaningful. Dr. Ebony Cornish is a medical doctor and she was talking about, I really liked her vibe and she was talking about infections and hormones and how they're connected to the inflamed brain. And the thing that really I wanted to mention that she brought up is how she sees a lot of benefits in using imaging to further evaluate brain health. And so we can listen to patient's story, do a physical exam, and maybe come up with a diagnosis. But prior to that even being diagnosable, a lot of brain health concerns are visible on imaging. And so, for example, she was talking about using things like CT scans to evaluate the state of like inflammation in the brain, blood flow throughout the brain, evaluating for TBIs, limbic system health, and a lot of other applications for using imaging as a in evaluation tool. And as much as, we wanna be cost saving as much as possible in functional nursing, a lot of times our patients are getting these things done anyway, and they have these results, and just looking at them in a little bit more of a richer way can really help inform our plan of care. Dr. David Katz is really well known for his thoughts on nutrition, and he talked some about the new dietary guidelines and which parts are meaningful and how some of it still needs attention. But he really talked about how we look at evidence and how challenging randomized controlled trials are for researching nutrition. And in the allopathic space, that's still like, if we talk about that we have a study that's a small cohort study or an N of one or anything in the functional space that's a smaller research as that we're using to guide practice at all, they will be like, we need randomized control trials. And he just really spelled out really clearly. Most of the hour he was talking was acknowledging all of the challenges with expecting randomized control trials for any nutrition guidance. And many of the talks centered around, personalizing nutrition. And so we can't have these massive studies to validate what we're doing with nutrition. And it really reminded me of the interview I did with Dr. Terry Walls a couple years ago on here, and you can go back and listen to that. And she talked a lot about the research she was currently doing at the time and just at large in her career, how difficult it is to set up nutrition studies just because it's not a controlled environment. Every person's genetic response to nutrition is different. Every person is going to eat what they're going to eat. It's hard to control. Even if you say somebody's on like a Mediterranean diet, what does that look like? What are the portions? What's the macronutrient distribution? Are they like cheating, right? Like eating things that aren't contributing. So it's a really challenging thing to do large studies that might translate well in the allopathic setting to inform practice on nutrition. So I appreciated that talk. And along the vein of nutrition, because I could tell you about like, there were a ton of talks, but what I thought was really great is we had decided to go listen to Everest Goldstein, our faculty, talk about nutrition and mental health. And I feel like her talk was one of the ones where the most people were like, really, it was very actionable. Like everything she was talking about is things you can go do with your patients tomorrow. And people seemed really excited about what she was talking about. But I thought it was really sweet that we were like 2 or 3 minutes late because we were at the exhibit booth talking to somebody. So we were sneaking in across the back and she was like talking and paused. She's like, "I'm sorry, my friends just got here." And I like felt bad for interrupting her, but it was fun to like, I know anytime when I'm giving a talk, like looking out in the audience and seeing some of your friends is really great. So, overall, spending time with some of the faculty and getting to know them better. We got to go out to eat several times, got to go to a Broadway show. We had really wonderful time. My sons were able to come as well and help us with setting up the exhibit and breaking it down and taking all that to the airport eventually. So all that was lovely. Having the booth itself was a great opportunity to have a lot of important conversations that I don't think would have taken place otherwise. We talked to universities about possibly licensing the program eventually. I've had like several of those conversations lately. The program's being built and delivered now. And so I'm like, okay, that's going to have to go on the back burner, but I'm going to have some clear answers for people soon. And I think that's wonderful because as I've said for a long time, this should be in nursing school. It shouldn't be something that we're teaching to some nurses later. It should be what we're all doing. So that was fun. I mentioned we talked to potential students, talked to a lot of people about possible partnerships, and a lot of experts excited to give talks over the coming year to students in the program. We talked to a lot of the companies that are happy to give us bonus material for the program for the students to learn more about, like for testing in particular, using advanced testing in their practice or understanding it if they're not using it themselves, but maybe they're working with an MD or nurse practitioner who's using it. A lot of the lab companies were offering, like, we'll be able to give discounts and things like that. That was exciting. All of them were like very enthusiastic about it. And one thing that I wanted to touch on there that is probably, I think, maybe something that we can all play a role in is I asked each of them when I remembered to, which was not always, if they allowed registered nurses to schedule calls to review lab work. You may know that a lot of the advanced functional lab companies will let you set up an account. And then once you set up the account and maybe you're like a lot of my students will use Avexia or Rupa or something, they're getting this lab work or the patients are coming to them with this lab work. Nurses absolutely are able to review lab work and educate patients about the results. They cannot diagnose a patient, they can't prescribe anything. One of my big examples is always stool tests showing poor eating hygiene and digestion. Like that's a nurse's role to do the teaching there around eating hygiene and digestion and mindfulness. That isn't something a physician's going to have time for in a quick visit. My argument with these companies is always like, why won't you let a registered nurse review results with your lab experts? And a lot of them will even let like health coaches set up an account. I just and I it always gets me if I go to register for a webinar and the boxes you can check for attending, or you have to usually put in your name and your email address, and then it'll ask if you are a medical doctor, a naturopathic doctor, a chiropractor, a pharmacist, a dietitian, a physician's assistant, a nurse practitioner, or a health coach. I think I covered like, typically, that's it. Often, they will leave off registered nurse. Whenever I see the opportunity to contact somebody, I try to mention, it's the largest healthcare profession, the most contact with patients are the ones like registered nurses in a clinic are the ones that are, like, seeing the lab results, calling the patient to educate them on the results. Not a lot of providers are, like, calling patients between visits to discuss lab work. They're often, like, telling, their nurse, like, "Oh, can you please call this person and say XYZ?" I think it's really important, just like in every other area of healthcare, that nurses are able to understand the results and able to ask questions. I started having those conversations with the lab companies. I encourage you to do the same, just really pointing out that, lab companies, somebody made the comment that some of the folks there consider nurses to be pillow fluffers. And when the person came back that I got the impression was the one that had said that, I told them that moving forward, we were going to be promoting nurses working in this space more and playing a much larger role. If some lab companies were going to get on board with supporting nurses in that space better to provide safe and ethical care, and some weren't, that was really going to maybe shift a dynamic for them. I think we all need to kind of point that out to them. If you get the opportunity, please do. I think that's everything I was going to say about the booth. It was so great to have the faculty there and, people coming up and asking questions and everybody getting really enthusiastic about launching the cohort this week. Ultimately, on the final day, we realized a blizzard was coming. And so most of us got stuck there and didn't get home until midweek the next week. It was very fun to be able to see New York City in a blizzard, and our room, the conference was near Times Square, seeing Times Square empty with no lights on. And then I took some videos that were kind of and then it lit back up over the next day, and how I've never been somewhere that took such a role in keeping things open. And even during the blizzard, going out to get food, things were open and people were in front of every building shoveling and using machinery to keep the sidewalks safe for people. I didn't expect that at all. I thought we were all going to just stay inside until it was over with. I thought it was really remarkable what a community effort it was to keep the economy moving. All the businesses were going to have to shut down. I definitely was impressed by that. Not as impressed by being stuck there, but it was nice to have a few more days to kind of catch up on some things, but needed to get home to get the program off the ground. I think that's everything I was going to share. I normally do one of these for each conference and go a little bit more in depth into the actual discussions that each of the speakers had. I will be definitely doing that for IFM coming up in May. If you're planning to attend that, we will be there and have a booth. And then I'm speaking at the American Holistic Nurses Association conference in Niagara Falls in June. And so we'll see you there. We're going to have faculty at these conferences. If you're going to be there, come up and say hi to us at the booth. We have more coming up later in the year. I've been at booths through the years for sure, but being able to be there and really talk about who we are to people who have never heard of functional nursing or thought about using nurses in their practice to increase access and maybe relieve the burden on the provider. It was really great to be able to have those conversations. I think more and more of that needs to happen for us to help advocate for nurses getting jobs in this space also. So I hope to see you at one of the conferences soon. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.